Anemia. Anemia is a medical condition characterized by a deficiency of red blood cells or hemoglobin in the blood. Hemoglobin is a protein found in red blood cells that carries oxygen from the lungs to the body's tissues. Anemia can lead to a variety of symptoms such as fatigue, weakness, shortness of breath, pale skin, dizziness, and headaches. There are many different types of anemia, including iron deficiency anemia, vitamin deficiency anemia, hemolytic anemia, aplastic anemia, and sickle cell anemia, among others. Anemia symptoms. The symptoms of anemia can vary depending on the severity of the condition and the underlying cause. Some common symptoms include fatigue and weakness. Anemia can cause a feeling of extreme tiredness and weakness, even with light physical activity. Pale skin. A lack of red blood cells can cause the skin to look pale or yellowish. Shortness of breath. Anemia can cause a reduced amount of oxygen in the blood, leading to shortness of breath or difficulty breathing. Dizziness and lightheadedness. Low levels of oxygen in the blood can also cause dizziness and lightheadedness. Headaches. Anemia can lead to headaches, particularly if the condition is severe. Rapid or irregular heartbeat. Anemia can cause the heart to work harder to pump oxygen-rich blood to the body, leading to a fast or irregular heartbeat. Cold hands and feet. Reduced blood flow to the extremities can cause a feeling of coldness in the hands and feet. Chest pain. In severe cases of anemia, chest pain may occur due to a lack of oxygen in the heart muscle. If you are experiencing any of these symptoms, it is important to talk to your doctor to determine if anemia or another medical condition may be the cause. Anemia causes and risk factors. Anemia can have various causes and risk factors, including iron deficiency. The most common cause of anemia is a lack of iron, which is needed to produce hemoglobin in red blood cells. Vitamin deficiency. Anemia can also be caused by a lack of vitamins such as vitamin B12 and folate, which are important for red blood cell production. Chronic diseases. Certain chronic diseases such as kidney disease, cancer, and autoimmune disorders can affect the production and lifespan of red blood cells. Blood loss. Acute or chronic blood loss due to injury, surgery, heavy menstrual bleeding, or gastrointestinal bleeding can cause anemia. Inherited disorders. Inherited disorders such as sickle cell anemia and thalassemia can cause anemia by affecting the structure and function of red blood cells. Pregnancy. Pregnant women are at increased risk of anemia due to the increased demand for red blood cells to support fetal growth. Certain medications. Some medications such as chemotherapy drugs and nonsteroidal anti-inflammatory drugs can cause anemia as a side effect. Malnutrition. Poor diet and malnutrition can lead to anemia due to a lack of essential nutrients such as iron, vitamin B12, and folate. Age. Anemia is more common in older adults due to decreased production of red blood cells and increased risk of chronic diseases. If you have any of these risk factors or suspect that you may have anemia, talk to your doctor for proper diagnosis and treatment. Anemia diagnosis. Anemia can be diagnosed through a series of tests and evaluations, including medical history. Your doctor will ask about your medical history, including any symptoms you have been experiencing and any underlying conditions that may be contributing to your anemia. Physical exam. Your doctor will perform a physical exam to check for signs of anemia, such as pale skin, rapid heartbeat, or low blood pressure. Blood tests. Blood tests are used to measure the levels of hemoglobin and other blood components such as red blood cells, white blood cells, and platelets. Blood tests can also check for iron, vitamin B12, and folate levels to help determine the cause of anemia. Bone marrow biopsy. In some cases, a bone marrow biopsy may be performed to examine the cells in the bone marrow, which can help diagnose certain types of anemia. Additional tests. Depending on the suspected cause of anemia, your doctor may order additional tests, such as a stool test to check for blood loss in the digestive tract or a pregnancy test for women of childbearing age. It is important to talk to your doctor if you are experiencing symptoms of anemia, as early diagnosis and treatment can help prevent complications and improve your quality of life. Anemia treatment. The treatment of anemia depends on the underlying cause and the severity of the condition. Treatment options may include dietary changes. In cases where anemia is caused by a deficiency in iron, vitamin B12, or folate, dietary changes and supplements may be recommended to increase the intake of these nutrients. Iron supplements. If iron deficiency is causing anemia, iron supplements may be prescribed to help restore iron levels in the body. Vitamin supplements. Vitamin B12 and folate supplements may be prescribed to treat anemia caused by a deficiency in these vitamins. Blood transfusion. In cases of severe anemia, a blood transfusion may be necessary to replace the lost or deficient red blood cells. Medications. In some cases, medications may be prescribed to stimulate the production of red blood cells, such as erythropoietin-stimulating agents. Treatment of underlying conditions. If anemia is caused by an underlying medical condition, such as kidney disease or cancer, treating the underlying condition may help improve anemia. Lifestyle changes. Certain lifestyle changes, such as increasing physical activity and quitting smoking, can help improve symptoms of anemia and promote overall health. Work closely with your healthcare provider to determine the best treatment options for your specific situation. In some cases, treatment may be ongoing to manage chronic anemia or prevent recurrence.